Hello everybody and welcome. My name is Dr. Christina Karamanidou and I am the lead of the Health Psychology Unit here at the Institute of Applied Biosciences of the Center for Research and Technology in Greece. We would like to thank the European Hematology Association for inviting us for a second consecutive year to organize and deliver a communication skills training session. This session was organized by our multidisciplinary team here at CERTH with a generous contribution of patients with hematological disorders. The subject of today's session is embracing challenging emotions, which are often experienced in the context of the interaction between patient and physician. We hope that you find this next hour informative and inspiring in terms of addressing these challenging emotions in your everyday practice. Now I will hand you over to my colleagues who will take you through this session.
Hello and welcome. My name is Dimitris Kirou and I'm a clinical psychologist. Here with us today is also Nicholas Frondaras, a health psychologist. In this presentation, we will be talking about how to embrace challenging emotions in clinical practice. I would like to start by giving you an overview of the presentation. First, we will listen to patient and physician quotes drawn from interviews we have conducted for research purposes in the Institute of Applied Biosciences of the Center for Research and Technology in Greece. Next, we will present to you some short theoretical concepts regarding emotional regulation in clinical practice. Video demonstrations of clinical skills and examples will also be presented along the theory. Lastly, we will present some more patient and physician quotes. So, let's see a few quotes regarding hematology patients and physicians' difficulties.
There are many times that you have a question that comes to mind. We all want to spend some more time with the doctor. This is a psychological need, to be with the doctor. She talks to you, she pays attention to you. It's not like, hurry up, you have to go in 5 minutes. That means you feel that she cares for you. This is what I think, we need this extra time.
What made me sad was that I didn't know about my white cell count. I didn't know my diagnosis. And I asked the doctor, I called him on the phone after I went to the patient organization meeting, and I asked him, why didn't you tell me I have leukemia? I could fight it on my own. There have been others before me that have fought cancer on their own. And he told me I didn't want to upset you. Am I not even more upset now?
There was a doctor with whom I did not have a very good collaboration. Because I kept telling her what I felt, and she was saying, okay, we'll see. I had been complaining about night sweats while sleeping. And she always answered, that's nothing, that's nothing. I may have not reached the dead end, but I have reached a burdensome point, so to speak. Say, I have to see and talk to someone, I must endure it. I must go through this ordeal. Or to open a door in the ward, seeing a particular patient who I know is going to psychologically tear me apart with her question and her anxiety. Overwhelming anxiety, but mainly the family environment, where everyone is going to fall over you at once and you are left feeling like you are suffocating, that you can manage. I have been drained out. I'm not sure what more there is to say.
You don't want to look at them in the eyes when you know that they will die. You feel like you are lying to them. You start the ritual. Yeah, this will pass. You know this probably won't pass. You feel like you are mocking them. I don't know if they are aware of it. You are acting like this, thinking that they would not realize. Give them some hope, because somehow they have to move forward until death. Let's say they realize they are dying. They will tell you they are afraid. What is anyone supposed to say to them? Sometimes, depending on my overall mood, I even get teary-eyed. I would turn away. What are you supposed to say to them? I don't know.
The patient and their carer not only hear you, but they see you too. It's not like you're not going through this with them, but you're not crying with them either. I want to maintain the standing of the physician, meaning I will not get too emotionally involved, maintain a middle ground in my professionalism. I want to show that I care without reaching their depth of sorrow, because if I do so, I will take this sorrow with me back home.
As we just saw in the videos, all too often in clinical practice, physicians come across patients who experience challenging emotions. And this isn't just an issue for patients, it also has a strong impact on healthcare professionals' emotions. In the research we have conducted, many hematologists reported feeling helpless, shattered, and excessively burdened. They also questioned the way they respond to patients' challenging emotions, such as grief, terror, overwhelming anxiety, and sadness. How should one respond to another human experiencing such despair? This is the question we would like to talk about in this session, and we will do so by sharing with you what we consider, based on our research and clinical experience, a fundamental stance towards human suffering. The stance that we would like to talk about is called emotional containment. Containment was first proposed by British physician and psychoanalyst Wilfred Bion in the 1960s. Containing patients' distress means to stay emotionally present with them, responsive to their feelings and willing to engage with their experience. And that is a different mindset, a different stance towards human suffering. In medicine, all too often we try to fix patients' problems. That is the job of a physician. But this kind of fixing cannot be applied to emotional matters. So rather than fixing, we could look at the physician's role as trying to contain challenging emotions. In order to get a clearer picture of how one can contain patients' emotions, we will talk about the setting of the consultation, emotional regulation, and ways of responding verbally and non-verbally to patients with high negative emotions. The setting itself can be containing. A quiet environment, free of distraction, with closed doors and no phone calls can make a big difference. It's also important to be sitting facing each other without having many obstacles like PC screens blocking the space between you and your patients. All this communicate our willingness to provide uninterrupted attention. Managing our work environment might require some effort on our behalf, but is well worth it as it conveys to the patient the message that we and the organization in which we work are able to provide emotional safety. Containment promotes better emotional regulation, and this video shows how effective emotional regulation can take place. Emotional regulation can be seen as a feedback loop between patients and healthcare professionals. The patient's emotional experience is highlighted in red and can be considered the start of this loop. The patient's experience can be any feeling and can be triggered by several situations in medical practice, for instance, bad news, a painful procedure, etc. The patient's emotional experience is then expressed in one way or another. For instance, the patient might start crying. Then, this might have an impact on the emotional experience of the physician. For instance, discussing with a really sad patient can make the physician also feel really sad. In a good consultation, the physician will become aware of their own sadness as well as their patient's sadness and then try to cognitively process or think about the whole situation before responding. If the response is able to convey to the patient that they care about them, understand their feelings, and are able to stay present with them, the emotional experience of the patient is likely to become less frightening and disturbing. Going through this cycle multiple times would result in emotional regulation for both patients and physicians' emotions. Now let's take a closer look at each step of this video. As we already discussed, the emotional experience of the patient will be expressed in one way or another. The key here is to be attuned to the patient's verbal and non-verbal communication in order to recognize how they might be feeling. The patient's emotional experience will probably have an emotional effect on the physician. one might instinctively resonate with patients' feelings, feel sad for their sadness or angry at their anger. The emotional experience of the physician could also be quite different from the patient's one. One might, for example, feel anxious about treating a very angry patient or anger towards a highly stressed patient asking tons of questions. Knowing what triggers intense emotions for you is really important in getting better at managing your own reactions. Your initial emotional experience may at times be quite heavy and difficult to manage. The key message here is to take a step back and not act upon it. Allowing a moment of awareness of your experience is really helpful. Something like, I realize I feel so uncomfortable right now that I wish this part of the consultation ended is the first step. Accepting your emotional experience is equally important. It's okay to feel burdened, vulnerable, uncertain, angry, and a lot more in face of patients' difficult emotions. Note that many of these are also some of your patients' emotions, and being able to accept them in yourself, you become more compassionate towards them. In addition, being compassionate to yourself can be liberating and provide the mental space you need to reflect on the situation. After you become aware of your own emotions that got triggered, it's helpful to think about how your patient might be feeling, based on their specific situation and experience. This requires a mental distinction between your own emotions and those of your patient. Only after making this distinction, one becomes able to fine-tune their responses to their patient's specific situation, experiences, and goals. And how can a patient know that you are willing to understand and stay present with their difficulties? Your responses will be the means of communicating this. If you provide responses which can emotionally contain both yours and your patient's difficult emotions, your patient's emotional experience is likely to soften. You may notice the impact of your response or their next expression of emotions. Going through this cycle multiple times during consultation would result in improved emotional regulation. But before discussing responses in more detail, let us take a look at what usually goes wrong in clinical consultations loaded with intense emotions. Going a bit back to the point where the physician's experience comes into place. If the feelings triggered to the physician are too intense, they might feel the urge to jump to a response without taking the time to reflect on their experience first. That's what we refer to as a hard balance. In a clinical encounter with a patient experiencing intense negative emotions, it's likely to either over-identify with them or take distance as a means of protection. For instance, in a consultation with a really sad patient who might start crying, one might feel intense negative emotions that are difficult to manage. In such case, one might instinctively withdraw from the conversation, stop looking at them and revert to the PC screen, or end the session as soon as possible. As a result, one would lose rapport with the patient and miss the chance to support them. On the other hand, over-identifying with patients' distress and fully immersing in their experience without taking a step back to reflect on it can also become problematic. For instance, due to your own intense worry triggered by your patient's worry, you might jump to giving premature reassurance by saying something like, "Don't worry, all will be fine." This will be targeted at alleviating your own emotional experience rather than your patient's one, and it's unlikely to really reassure them at that moment. It is only when one can balance these two that one can provide a helpful response. A response by which we convey to the patient that we can stay present with their feeling is needed the most during such moments. Being mindful that the best you can do is contain your patient's affect, rather than dismissing, prematurely reassuring, or trying to correct things, is likely to help you provide such a response. Now, let's take a closer look at which responses specifically may help in this direction.
Drawing from multiple theories and models, let us now see how we can respond to patients and help them with their challenging emotions. The majority of communication is non-verbal. This means both reading the patient's non-verbal signals, but also using yours to communicate more effectively. Non-verbal communication is very important for containing patients' difficult emotions. You may not say a word, but still convey to your patients that you understand them, that you care about their feelings. On the contrary, you might offer tons of reassurance and yet not manage to connect with them. These may seem well known and established, yet according to research, patients frequently complain about non-verbal communication. It is important to them and can lead to miscommunication and even a breakdown in the relationship. Let's see the most frequently submitted complaints. Regarding eye contact, imagine while I'm here talking with you, I start looking on my notes or on my computer. You may still be on my mind, but you don't necessarily know that. And it's true, when taking notes on a computer, it might be challenging to maintain eye contact. Nevertheless, we recommend it and recommend facing the patients too, especially when they are speaking. When breaking this eye contact, try and explain why you are doing so, what you are noting, and overall keep the conversation going. Paralanguage is about how your voice is delivered, like your tone and your volume. Try and notice how the person in front of you is speaking and try to mimic them. Are they soft-spoken or are they louder? It would be different for everyone. For example, speaking loudly to someone who has hearing difficulties might be appropriate, but not for everyone. Inappropriate facial expressions can lead patients to question the quality of the communication and even the abilities of the physician. For example, sometimes you may be tired. You may have just gotten out of a long meeting. Patients may not necessarily know that, but rather they will think your expression is about them. Nevertheless, you can share that you had a long day. This might make things a little easier. Oppositely, distancing but not showing any expression might also make them feel not understood. If you are not confident about your non-verbal communication skills, you can always verbalize some of your feelings. Asking an open question will allow the patient to take the conversation to what they feel is important or relevant without having to limit their responses. Once you know what those things are, you can then use them to better communicate and connect. So, when trying to manage challenging emotions, try not to ask for specific information or for questions that are answered only with a yes or a no. Even if they respond in that way, try to get them to open up a little more. In itself, openly expressing themselves while you listen can be containing and can help people regulate their challenging emotions. Some examples of open questions are: how was this for you? How did it make you feel? And what would you like to do? Then try and listen what the person in front of you is actually saying. Sometimes you may feel that you have heard this a million times, that you know where this is going and you can be tempted to interrupt them to save time. However, this might make them feel unacknowledged and will lead you to answering a question you have not heard yet. Taking it a step further from listening and asking questions, you can respond by using restatements and reflections. These help the person in front of you feel understood and help them open up more. Restatements are simply rephrasing of what the patient has just said. For example, so you spent the night wide awake, or you couldn't understand why this was happening. Reflections are about naming emotions, like using a mirror to reflect back to them what you think they may have felt. For instance, you sound sad. Did this make you feel worried? Naming emotions can help them identify their feelings, connect with them, and even regulate them. Even if you have the perfect understanding of someone, it is not going to be very impactful if they do not know that. so share what you have understood back to them. This will help them realize you are listening to them and that you are paying attention. Let us now see a couple of video demonstrations of real patients. The first with someone who is angry and the second with someone who is sad.
So, how are things going with your treatment?
Not great.
Okay, so things have not been great lately. Is it because you have not been able to take your medication regularly, or is it something else?
I don't like your question. It's because I have been taking my medication that I'm dismissed.
You seem a bit annoyed with this.
Annoyed doesn't even begin to cover it. I thought I was clear when we talked about this in our last meeting. These side effects are a major issue for me. I've tried everything and nothing works.
I'm really sorry about this. It seems that things have been really difficult for you. Would you mind telling me how exactly is it affecting you?
I can't work properly. I can't enjoy my time with my family. It has taken over everything.
So, taking your medication is really impacting aspects of your life, and that is clear. Your work life, your family relationships are affected as well. And you said that you have tried everything that you could think of, but nothing works, right?
Exactly.
Okay. But this is a good thing that you brought it up. Because at least now, you talk about how to make things for the better for you.
Yes.
If you have a keen eye, you may have noticed that the physician started by making a not so open question. Nevertheless, they realized and then amended their wording. So you can always amend what you have said or make up for it later. We saw the hematologist was trying to assess for adherence. However, the patient took the conversation to another direction. So taking the lead sometimes from the patient is best. We also witnessed that a good way of helping someone who is angry, instead of telling them to calm down, is to ask for their story. Ask what has happened, and then listen and contain their emotions.
After our discussion about your test results, are you ready to discuss about the next steps?
No, not really.
You look concerned. Would you like to tell me more about it?
I'm still trying to get around my head what you have told me. I thought the things were going well. Anyway, what are the next steps?
We can talk about next steps, of course, but before that, I see that this news has taken a toll on you.
Yes, I didn't see it coming, and I feel I have lost some steps. This is too much for me.
So this came out of the blue for you. You sound disappointed.
Yes, because I was expecting this to work and things will get better. But now I feel I am lost. How can I plan my future now?
You seem to be uncertain about your future right now, and these feelings are not uncommon when things don't go as expected.
I guess you are right.
And not only that, we still have some pretty good options available to us.
Are there?
Yes, of course. Would you like to learn more about them?
You may have noticed that the patient redirected the discussion away from their emotion, but once the physician gave them the room to talk about them, they opened up and were more able to engage in discussion instead of only half listening due to their attempts to manage their own feelings. After successfully managing them, the two were able to fully explore their options together. Encouragements are statements and gestures that recognize patients' strengths, no matter how big or small. It's about encouraging them to go to a direction that's better for them by supporting them and offering positive feedback. For example, this sounds to be good for you, or it's a good thing you told me. Validation is the recognition and acceptance of another person's thoughts, feelings, and behaviors as understandable. Most of us do not have first-hand experience with the illnesses the patients might be experiencing. Therefore, it is hard to completely understand them. This is why, by being kind to them and their experiences, we can help them go through it. We can validate the patient's experiences with expressions like, "No wonder you were upset. It is completely understandable to be feeling this way. I might have done the same if I were in your shoes." Normalizing refers to making something normal by implying it is commonplace or by explaining it in an ordinary and non-threatening way. In your line of work, you see many people go through hardship. Think about some of the common responses and let them know that most people in their situations are having similar reactions. This can help them feel like they are not alone and that they are not having any irregular emotions. They should not worry about what they feel, they should just have the space to feel. For instance, anyone would do the same, most people say the same thing. Despite all the listening and nodding we have been promoting in this session, it would be wrong of us not to include how best to share some of your knowledge with your patients. You know best what to share with them. Here, we're going to focus a little bit on the how. We propose to ask, educate, and ask again. Using an open question, ask them what they would like to know and answer that. Once you have provided some information to them, ask again, how does it sound to them? Do they have any follow-up questions? For example, what specifically did you want to know? You listen to the response, and then, about this, we know it is best to take it twice daily. What do you think about doing that? At the end of the consultation, or at the end of an important part of it, try to summarize the points discussed. Make sure to include some comments and feedback the patient raised, but also what you feel is necessary for them to remember. Ask them at the end if you have forgotten anything to see what they feel is significant. For example, you mentioned that you wanted to change your energy levels as you have trouble going for long walks with friends. Then we discussed about changing your diet and medication in order to achieve this, and you were happy with the plan. What would you like to add to this? Let us now see two more demonstrations, one with someone who is withdrawn and another with someone who is anxious.
So, I regret to tell you this, but based on what we've discussed last time, I'm afraid we need to read some tests.
Okay.
So, these are the examinations. Would you like to take a moment to discuss about them?
No need. I'll just go to the lab.
Okay, you seem a bit discouraged, which I guess it's only natural to feel this way after a while. Is it too much to have to take this test again? Is that it?
Yes, I'm just thinking how many times I have to go through this all. Anyway.
I see. That is true, you have been through this before. Okay, I can see how you have come to feel this way, so disappointed right now.
I truly am.
Yet, if you allow me, you still have the will to come to our appointments and fight this condition.
It's the only thing I can do.
And I know it's hard, because you're trying to do what is best for your health, right?
Yeah, I guess I do so.
And I can see that, and that's really important, don't you think?
Well, what did you want to tell me about these exams?
It would have been easy for the physician to avoid noticing non-verbal signs and agree when the patients say, "Then just go to the lab." Nevertheless, taking the time to contain these feelings seemed to strengthen the relationship with them and improve the quality of care they provided.
So, in our last meeting, we discussed about your new diagnosis. Now that you had some time to process it, would you like to talk about it?
Yes, actually. I read that it is hereditary. So what are the chances my children will have it too?
This is an issue people worry about often. Would you like to tell me a bit more about what you have read?
I read that because I have this condition, my children would be more likely to get it. So this got me very stressed.
So we talked about your new diagnosis, then you tried to find some more information and then you got stressed out.
Yeah, more or less.
So what we do know is that for family members, the likelihood of having the same disorder is slightly higher. However, the overall probability still remains really, really low.
But do they need to be tested? Do they need to be monitored? Is there anything we can do to help them? I'm very afraid for their future.
This is important to you, and that's totally understandable. This is to be expected as you want to know how to protect your family. I can assure you though that the research studies are in your favor. You do not need to take any further actions. Your children are only a little more likely to develop it compared with the general population. It is not as straightforward as you have this condition and they will have it too. Now that you know more about it, how do you feel?
A bit better actually. I hadn't realized that they won't really have it too. This is what you are saying, right?
Exactly, correct.
Okay, I really wouldn't want them to have it, but I guess I can take comfort because the odds are in our favor.
I understand that you still are a little bit uneasy, but of course we can revisit this issue again. The good thing is that I feel that you are a bit calmer right now, and of course you have to take all the time you may need.
What you may have noticed is that instead of going straight for the education, we recommend taking only a moment to ask an open question. Ask, educate, and ask again. This way you will be better able to understand what the true issue is. Otherwise, you may end up having to provide much more information, and that may not be what the patient is looking for. Similarly, it was only after the physician contains the emotion of the person in front of them that they were able to move on to providing information to them. Lastly, giving them the option to talk about it again later will help them feel at ease. Now we are going to hear once again quotes from interviews conducted with people with hematological conditions and hematologists. This time we'll hear about how they perceive the relationship with their respective hematologists and patients.
So the vast majority of people we see actually reciprocate emotionally. If we put in the effort once, they reward us many times over. And a colleague actually just told me that a donor who is a farmer brought us oranges. I mean, they respond in kind by saying thank you, by smiling when they see you, by asking something personal, not role related. And generally it is a very rewarding profession. You get back as much as you give. Usually you get back more than you give.
Many children I treated when they were young now bring me their own little ones. That's something that has always touched me deeply, and I love it very much. Because you see what your impact is. That's the one thing that I'm always touched by. But there are a lot of little things, you know. It's not always the big things, it's the little things. And something they will say that reveals they care.
For me, there is a positive appraisal. The things I receive, regardless how hard I have to try, I think that at the end of the day, the appraisal is positive. I take back plenty from these people. Little things to notice as you receive their love. This is what ultimately justifies all you do. The long hours, the many things you have neglected.
I was feeling that while I was talking, I felt safe, that at any moment she would be there waiting for me. And that was really important, regardless if I had to continue as before. That's really moving.
I love her dearly. She's such a sweet woman. She sits back and listens to you. And this listening to you plays a very big role when you're a patient. She asks about my problems every time. I tell her all about my family, all of my personal stuff. She's a warm person. You tell her your problems, she doesn't just listen, she gives you answers, she gives you solutions about things that trouble you. After every treatment, she always examines me and says, "You're fine," and I always leave the hospital feeling uplifted.
Her behavior is perfect, okay? She's not like doctors back in the day, with whom you didn't dare to speak to them. Now you go there, and she makes you feel like you have known each other for many years. How could I not be satisfied with her? It's the science which really knows well. Her behavior, her manners, all these things count.
Certainly, this was a lot of information to absorb. We encourage you to revisit certain parts of this session which have captured your attention. With time, we hope that the mindset we have presented can provide new insights and raise awareness with regards to emotional regulation in clinical interactions. We thank you for your attention.